Okay.
So therefore, so what do you want to do now for the treatment? What are we deciding on?
Yeah. So now the treatment planning is on the lower.
Yeah.
We will prescribe denture for the patient,
Yeah.
and in the future maybe we will put implant on three region.
Okay.
To be a implant retained lower denture.
Okay.
While for the upper, there's missing 1 3, and so 1 3 we will replace by fixed prosthesis.
Yeah.
And for the other tooth wear area, we will build up with crown or some composite build up.
Yeah.
Depends on the severity.
Okay. Do you have any concerns or particular questions that you're wanting to ask, or you're just checking this in general?
Just checking in general.
Okay.
And if talking about question, maybe I will question whether this case suitable for implant or RBB on 1 2, because I find that for the enamel amount on the neighboring teeth, it is compromised.
Okay, so we need to see a photograph of that, or see the patient clinically.
Okay.
Yeah. So if you were going to do the cantilever from here, which abutment would you be thinking of doing?
If abutment, I will thinking of 1 1.
Yeah, you don't have a choice there, do you? You can't put an RBB or crown bridge on there.
How about if we do a fixed one? For example, a fixed cantilever using 1 3.
You got quite a lot of tooth tissue loss there. Yeah, I don't quite like that. Yeah, I don't. Even if you built that up in composite, you don't have a lot of coronal tooth tissue remaining.
Yes.
To give you a strong core to support the bridge.
Yes.
So I wouldn't favour that myself. And then in the lower jaw, I suppose the question begs of, have you thought of converting that into an overdenture tooth?
Yes, I'm thinking of it.
Okay.
Yeah, and maybe in the future you will be planning to do RCT.
At the moment it's vital.
Yes.
So then, let's say you've made the denture and deliver it, what would make you then to consider converting it to an overdenture or leaving it as it is?
Maybe the patient size and symptoms.
Okay.
On the tooth, and also the stability of the denture.
Yeah. So what might make you think, you know what, we don't need to make this an overdenture abutment?
We don't need.
Yeah.
Is the retention? Maybe if the retention is adequate.
Yeah.
Yeah. So
and what else?
No.
What's the other important factor to consider?
The support.
Maybe. What's the other important
and
qualitative factor to consider?
The qualitative factor.
Yeah.
And the mobility of the tooth.
The patient.
Oh, the patient.
That the patient's happy with it.
Oh, I see.
You know. Yeah. So that could still be, even though whenever I see one or two last standing teeth, I go, you know what, they'd be better as an overdenture. But maybe maybe that might work for them. Yeah. Okay. So yes, that'll work, and then you've just got to work out on the anterior whether we clinically we can look at that tooth, and then we can work out whether we do that as a cantilever.
Okay.
And you're right, the build-ups on the anterior teeth.
Yeah.
You could do with composite.
So for the next step, I will proceed the denture for the patient, and at the same time, I'll build up the composite.
Yeah.
As professional.
Yeah, and then also you got to make sure that you do. I'm not sure about the quality of this wax up, because you might be using that as an index.
Yes.
Perhaps. Because it's a little bit. You might consider. Or would you just build that up direct the best you can?
Yeah. Actually, I've done 2 wax ups.
Yeah.
So this is for 4 incisors, but it shows in the patient it seems the teeth size is small and also it's quite crowded.
Okay, it doesn't look that bad. I'm not sure I doubt the patient will complain too much on that. It still looks pretty good.
I've tried in the patient's mouth, and patients like this model.
Yeah. Okay, well in that case that's fine. So then you've got your solution there. And then you just got to work out what you trim there with regards to not what you trim, what you wax up, and you might just try and build it up directly.
Okay.
Yeah, but well, I think we need to look at photographs later or the patient to confirm that.
Yeah, sure.
Yeah.
Yeah.
Is that all right?
Yes.
Okay, fantastic. Thanks.
All right. Thank you.